Welcome back. Baptist Health Community Outreach was recently awarded a huge grant from Verizon to help conduct a year-long diabetes project. More importantly, if you have diabetes and if you live in Central Arkansas, you might be able to benefit. Joining us this morning to explain how you can take part is Baptist Health's Wendy Bird, who is a certified diabetes educator. Good morning, Wendy.
Morning. How are you?
I'm doing good. How are you this morning?
Good, thanks.
Well, first, tell us about the program.
Well, Baptist Community Outreach recently received a grant from Verizon for over $400,000 to leverage technology to improve diabetes self-management in the underserved population.
And why is this project so important, especially here in Arkansas?
Well, this group of Arkansans, they're at risk for excessive use of health care and poor coordination of services and also poor outcomes.
You know, we see studies come out and say we're not a very healthy population here in Arkansas, and when that's the case, I'm guessing the cases of diabetes go way up.
It did. From 1999 to 2008, there was a 44% increase in diagnosed diabetes in Arkansas.
All right, so there are people watching right now who say, hey, I'm here in Central Arkansas. I may be at risk or may already have diabetes. Who can qualify for this study, and what will they get out of it? Why should they want to get involved?
Well, anyone that has an actual diagnosis of diabetes and is required to monitor their blood glucose on a regular basis.
So they're eligible?
Yes.
All right,
yes.
So if they call in and say, hey, I want to be a part of this study, give them some incentives. Why would they want to get involved?
Well, we're looking for 250 people, and it'll be two groups of 125. Each group will get different types of technology. The control group will get basic technology that everyone uses today, and then the variable group will receive some of the things here, like a cell phone with a service plan. They'll also get a wireless glucometer and blood pressure cuff where the data comes directly to our database.
Why would a cell phone with a service plan be a benefit to someone who has diabetes? Or is that just the incentive to get them to participate?
Because they can text me their questions.
Oh, okay.
Yeah.
Well, that's nice.
Right.
The Fitbit, Fitbits in the Channel 7 newsroom have been going around. Steve Sullivan's wearing one, Jordan Baki's wearing one, I've got one. Fitbit's a part. I'm guessing that's an inspiration to get people to exercise more, which helps with diabetes?
Yes, yes.
Would everybody get a Fitbit if they respond?
Half of the group will get a Fitbit and the other one will get a basic pedometer.
You mentioned at the beginning the first control group will get the basic things that anybody with diabetes uses to help battle it.
Correct.
What is that? What's the basics?
Like this glucometer right here, it is over the counter and it's available to pretty much anyone that wants to go purchase it. The one that we're using from the variable group, it is wireless, and like I said, the data comes directly to the database. So you don't have to call in your results to the doctor, anything like that. It just comes directly to us, and then I'll analyze the data, and if your blood sugar readings are off, you know, I'll contact you and we'll try to work out what's going on.
What is the goal? What do you hope to learn through this study?
Well, we really want to see if using this higher technology makes a difference in the total outcomes.
So see if technology improves people's diabetes.
Right, leveraging technology to improve diabetes self-management.
And that's why Verizon is the sponsor.
Exactly.
Because they're the provider of the technology.
Yes.
Okay,
yes.
It's all coming together. So if somebody who's watching right now, one question they may have is, how much are they going to make me exercise?
Well, that's probably going to be somewhat...
Are you trying to change a lifestyle, or...?
To a certain point, if you're completely inactive, then yes, we want to get you moving. I mean, that is part of the regimen for treating diabetes, and it's good for anybody, diabetes or not.
All right, so if somebody's watching and they want to get involved, how can they do that? What do they need to do?
They can contact my office at 501-202-1540.
Okay, there's the number, 501-202-1540, and they have to do it rather quickly.
Yes, as soon as we get the 250 participants, we're going to get going on it.
So first come, first served, and you've got to do it by the end of the month.
Yes, sir.
Okay, well, it sounds good. Thank you so much for being here.
Thanks for
I hope you
having
have
me.
a successful study.
Thank you.
You're off to a great start.